Alright, so welcome back students to the very exciting course Healthcare Entrepreneurship. Hope you all had been doing well. So in previous set of lectures, we have got a initial insight of what the healthcare startup scenario is in the Indian context. What are the key healthcare problems and challenges which the Indian market is facing right now. We have talked about several products and services which can fulfill those challenges and how you can find specific opportunities which can be derived from these challenges and opportunities segment. So, we also discussed quite a few products, what are the categorization of the market, how the healthcare system is looking like in the Indian context, what all product categorizations are there along with service categorization. So, this is a good starting point where we can build upon as this course progresses. So, today we are going to talk about a very exciting topic which is idea generation and need analysis. So, basically now we know the insight on what exactly the Indian scenario is, then how within this huge scenario we generate a particular idea and understand the need of that idea, whether that would be valuable for a customer or not. So, that will be the topic which I will discuss as we go further. All right. So, first component of the idea generation is identifying new opportunities in the healthcare sector, which we have already looked at from an overview standpoint, but we have to kind of deep dive into specific technologies or specific domains in which we want to work on. So, we cannot just search healthcare in general. It has to be let us say medical device in a certain domain, like for let us say gastro problem or some kind of an ortho problem. So, this has to be specific. So, we have to use the right keywords, place them in Google. There are a lot of market research firms which give you free kind of market insights into through the plots and graphs, as well as there are several other avenues where you will get some if you just look at the Google images, you should be able to link them back, some statistics into what the market in that specific domain is looking like. So, using the right keyword is the right choice. So, first of all, we try to identify this new opportunity specifically in the area which we are interested in. The second part is we try to understand the healthcare policies and strategies around this particular product or service idea, because whenever we are operating in the healthcare segment, we need to be very careful of whether the policies are supporting that. Like, so we cannot just come up with an idea which is very clinical heavy, and all of a sudden we see like we have no way to test it or clinically get it approved in order to take it in the market. So, you will be wasting a lot of resources and your time if you choose a topic like that, where you do not have a clear idea of what the healthcare policies and the strategies are currently with the government of India, and what all other ecosystems are existing around it. Right. So, understanding these policies is very important, which will be covered as a part of this course. I will be talking about several policies and how to look at it, whether your product or service fits into that or it is excluded and whatnot. So, we will be covering that eventually. The third part which you do is market research for healthcare product and service or a service. So, that basically means you have to look at have a deep dive in the market, what is existing, like is there an existing market going on where let us say let us take an example, you have this particular application based platform or an app based platform which is looking at how you can be healthy, right, like the right eating habits and the right exercises. So, you have to look into that market, that healthy eating apps or healthy exercise based app or healthy living app. So, these kind of keywords have to be used in order to look at what are the key statistics in the market, and you will be surprised to find a lot of statistics. There has been so many market research by top firms which are conducted on a day to day basis, and they will throw you statistics from let us say the past 3 years or the past 10 years and so forth. So, looking at that market as a whole will give you an insight whether that market is ready for your particular product or service. Otherwise, what you end up doing is you have to create a new market for the particular product or service, which in some sense may get challenging if you are a very early stage startup and you do not have a lot of resources and funding along with you. So typically what you would do is at least look at something which has some market, and then try to find a niche into that market. That's usually the way to go forward, right? So market research is very, very important, where we kind of go through all the statistics, what has been the growth curve, what is the CAGR, which is the compounded annual growth rate. We have talked about it. So what exactly are these? What are the sales projections? How many customers are possibly falling in this? How the demographics around that healthcare problem is changing, which you are trying to address. So all these details have to be mapped out, and you try to build that foundation like where you stand. The next part is having the right ideas. So let's say we understand the market, we understand what the issues are currently in the market, what are the policies. So we know all of these. Like, next point is basically what is the right idea or that very innovative idea which will stand out. So that is a very pertinent question to ask here. And the other question to be asked is, how is this needed by the customer? This is also a very, very important question, because let's say we have this great idea and we think this is the right idea and we pursue it, and we basically feel like this is going to really solve the difficulties of a particular set of customers, target audience, but you would figure out that this is probably not that needed by the customers. So that is where you apply something which is known as a customer discovery approach, which I am going to talk at length in the coming classes. Basically, that is where we will go stepwise approach, like we will follow a very clean approach to how to get from understanding an idea or the value which you could possibly add to a customer with your product and service, to actually understanding whether the customers will end up buying your product, because that at the end of the day is the most important. If nobody is buying your product or willing to pay for your product, then your product is a loss basically, right? So let's go forward. So a few more things about the right ideas. Typically what is observed is people are searching the term, I want to start a business but I have no idea. This is one of the very high hit Google searches, like, which is conducted all across the globe, and they do have the acumen for business. They want something to be really done to the challenges and problems of the society, to meet those, but they do not have a very particular idea or an innovative idea to follow their heart and really put their soul into it, right? So actually what we see is they want to start a business but really do not know where to begin, and I am hoping maybe majority of us would be in the same boat, like that we really want to do a startup in the healthcare space, but we do not know where to start or what is going to not put me in a lot of losses and possibly get me some profit, or something which could be a really tangible and sustainable business, right? So typically what is looked at is, if you look at the figure on the left, so there are 2-3 very simple exercises which you can do in order to understand whether you are getting towards the right idea. The first part is find your skills, hobbies and interests. So this is very, very important, because whenever you are a healthcare entrepreneur or an entrepreneur in general, you have to put your heart and soul and your entire time into it. It's not a 9 to 5 job, right? You have to always keep on thinking that how do I make this particular product or service sell, make the best version of it and get the next 100 or 1000 customers. So this is what goes in your mind till you sleep. From the time you wake up till you sleep, this is all you think about, and you also think about whom can I partner with, or whom can I collaborate with to leverage this particular business. So there are so many directions in which you are thinking. So typically this requires a lot of passion and perseverance. So this is not something where hard work is just good enough, right? So when you look at skills, hobbies and interests, so if you like to pursue something like music, or you are fond of speaking, or writing, this would usually be something which you are really passionate about, right? Like your skills and hobbies. and you would really want to find some extra time for doing that. But if you have a 9 to 5 job, you probably want to just leave the job at 5 and not work any further unless you are bound to do that, right? So that's why the first step in this right idea generation is find your skills, hobbies and interests. Does any of these healthcare startup ideas form a part of your hobbies or interests where you want to really do this, right? So this is number one. Second is find your pain points. So when we say your pain points, that caters to the pain points which you have as a person, as well as the pain points in the society which you are trying to solve, right? Then think about the world's biggest future challenges. So you have to start thinking about really great leaders and like a futuristic leader in this case, where you are trying to solve something which is very unique and very innovative, right? And probably very few have ever tried to solve it. That creates a very high barrier to entry. So, for example, if I am a professor and I am trying to solve a research problem which is specifically in my domain, which very few people in my domain have touched. So, automatically I am getting rid of let us say 95 or 98% of the general public who would have first of all no idea of this research problem and what is going around. And second is I am trying to create a barrier for the next 2 to 3% like of folks like who are doing research in the same domain or somehow not able to translate, or they do not have the right resources or the skills to do that. So, this is how I am creating the barrier to entry, that first of all 95 to 98% nobody really understands the problem very well, where I am an expert in. And second is I am creating another set of barrier of entry, like where the researchers in my field I am trying to be unique among them. And how do I do that? Through something which is known as a literature review. So, typically in academics what we do is we go to Google, or Google, there is a website called Google Scholar, and we try to search for particular keywords in our research domain, and we find review papers and several review articles and original articles which are there, and we try to read through that literature review, which is basically the introduction section. So, in the research domain, I get a very clear idea of what the pains and challenges of that particular area is. So, once I am aware of that, fantastic. So, I know I have created all the barriers of entry and also found the pain points currently in research, academics and the society in general, right. So, that directs me towards thinking about the world's some of the biggest future challenges, and then I start doing something and do it very differently, right, because now it's I have already differentiated myself where people are not able to really come up to my skill set level or the understanding level of a particular product and service, and this is a very unique way to do that, and you are in the right spot there if you have that kind of a position. So, many of you may have thought about certain healthcare based ideas, and you are probably involved with some startups at different capacities, and you feel like you want to really make a difference there. You want to really make a difference in the sense that you want to create a product or service which nobody else can copy, and you can basically make a big margin of profit like out of that. So, that is where you have to basically do something very differently. So, like I have just given you an example of research, so I am sure you also have something like that which creates a barrier to entry. Maybe you have been trained during your degrees or during your internships, like, or specifically in an area where you think very few players are there. So, that is where it is a good point to target, that this is a particular product or service which I would like to offer. Many a times you may be a clinical profession or you are from the medical profession, and you are let us say resident or a doctor somewhere, and you are basically, you have pinpointed some issue which is faced by the patients. Like for example, there was a recent case where usually the catheters which are used for urine collection after a surgery, there was a design modification which they thought would be really useful, which would be less painful, right, for the patient. So, this is something only a particular person who is a doctor in that particular domain can only think about. I or you, like, who is a let us say part of the general public, will not be able to think about that kind of a problem. So, these are very niche problems which is already a huge barrier to entry. So, we can all think about these kind of problems also, that is one approach. The other approach, you try to get into an existing market which is some products and services already in that domain, and you are trying to create a niche for yourself by making some innovations, and we will talk about all those innovative techniques as we go through this course, right. So, basically the keyword here is start doing something and do it very, very differently. So, that is something here can be something very niche or something very generic, but do something very, very differently. Differently is the keyword, right, and that finally leads you to the next business. So, this is an overview of how you have to train your thinking process in order to get to the right idea. So, let us look at the plot on the right. So, there are three circles here. First is what you are passionate about, we have already talked about it. Second is the blue circle, what are you good at. Third is what people are willing to pay for. So, very interestingly, you would think that when you are in the healthcare space and you are trying to develop the next big product or service, you would want to focus on the technicalities than anything else. But if you look at these three bubbles, do you see any tech part here? The answer is no, right. So, typically what I would like to summarize here is, it is not always the technology which you bring in first and think about how do I get a market about it, but it is the market which you look at first before you bring in a technology which you have some expertise in, right. So, just reiterating again, lot of startups actually fail specifically in the healthcare sector because they have dived quite early in the market thinking they have this greatest technology which they have patented, and this could possibly change the way the people think about it, and they are going to pay for it, like the hospitals are going to pay for it, so many stakeholders are there, and finally nobody wants to pay for that. That is the reality, and the startup fails, right. In order to avoid that, this course will typically take you through all the due diligence steps, like, right, like we will go through all the steps of customer discovery, market testing, the different kinds of marketing techniques before we actually go to the big tech part of the particular product or service. So, this is very, very important for us to understand. Let us look into here again, what are the three circles which we are looking into, like to generate the right idea, what are you passionate about, what are you really good at, and what are people willing to pay for. So, it is about yourself, where do I feel I stand and how well I can do a particular product or service or generate the idea about it, and are people willing to pay for it, right. That is where you find the sweet spot, and that is where a real idea from an entrepreneurial standpoint starts to generate. Let us go further. So, there are several other aspects to the right ideas. How do you evaluate whether your business idea is really worth pursuing? So, many of us may have come across, like, a bunch of friends who one day, like, just they are very tired of their jobs, they are bored with how life is going, and they want to come up with some ideas, this great startup idea which will change everything, and they sit with a pen and paper or on the whiteboard and basically start jotting down a few things and feel like this is going to really change things and start the company, right. So, how do you evaluate whether these kind of I would call it flash in the pan, because it is just a quick thought and it may not stay very long kind of ideas, whether it is worth pursuing, or you should progressively build an idea over time, probably a few years once you are gaining expertise or experience in that particular domain, and you evaluate it. So, where exactly should we start, and how do we evaluate whether the idea is worth pursuing? So, irrespective of whether your idea has come up in the last 1 hour or it has come from the last 5 years of experience, there are several factors which we need to consider while understanding whether this idea is going to worth pursuing for an entrepreneurial venture or not, right. So, what is the first point here? The first point is identity and uniqueness. So, we need to start thinking whether this particular idea is unique or lot of people and lot of companies are already pursuing this idea. So, this is number one. Knowledge and expertise. So, this kind of again solves our problem, whether we have knowledge and expertise to pursue this particular idea. So, many a times you would come up with an idea with artificial intelligence, blockchain technology or this and that, like with several buzz terms which you would think like is selling like a hotcake in the society, but you would have no expertise in that domain, or you want to develop an app and you do not know how to develop an app or how an app would even look like. If you are very clear about the different steps of the app, how it should actually look like, maybe then you can hire an app developer and translate your idea. But do you have any knowledge and expertise how that app platform is going to look like, or how this particular product is going to look like, right? So, some knowledge and expertise is required, irrespective of whether you have come up with this idea in the last 1 hour because you had a long expertise of 10 to 15 years working in a similar domain, or it could be 5 years you are trying to refine this idea and then you finally think this is the right place to go, right. So, that knowledge and expertise, if you do not have in a certain domain, like where you are trying to generate a product or a service idea, refrain from doing that, stay away from it. If your idea is not unique, you do not have the knowledge and expertise, stay away from it. That is the number one. Next is market or demand. Is there an existing market or demand for this particular product? So, let us say you are trying to make this really nice and sensitive thermometer, which is very rightly positioned in terms of cost, and you are trying to get it to a very high sensitivity, where many of the thermometers in the market may fluctuate in temperatures when you are reading the same person's temperature like in the next 4 or 5 readings. So, you want something which gives the most accurate reading. This is just an example. You want to build that thermometer. So, basically there is an existing market for it. Do people have a lot of demand for thermometers? That is something you will have to look into. So, probably the demand was very high during the pandemic, but it may be very low at this time of the year when this is summer and basically not many people are falling sick. The demand may go high during the winter season, right. And also the cost wise, like is this something which people are willing to purchase like with a new brand, or are they willing for foreign brands or something like that? So, that has to be looked at from a market or demand standpoint. So, if you are a new startup which is make in India, you might want to look at how the other make in India thermometers are selling. If they are selling like 80% of the thermometers sold in the market are make in India, for example, then you can be confident that your thermometer will also sell if it is giving a better price and better accuracy, right. So, this is the way to kind of bifurcate your thinking and think it very straight, that whether the market or demand exists for your particular technology which you are going to build, right. The fourth one is the startup cost. So, basically you would like to know whether this product or service which you are trying to build incurs a huge amount of cost in terms of like technology, manpower, the amount of resources in terms of having an office or website or an app developed or a server built. These kind of costs will add up. If there is a shipping cost, if there is a marketing cost. So, as an entrepreneur you have to start thinking in all the angles what all are the possible costs which are involved. So, many a times we would just think about that this is the cost of the product. Let us say we would need electronics and a lot of mechanical components overall for this particular product. For the building we would need 1000 rupees. So, now I can sell this for 2000 rupees and be an entrepreneur. Not true. We have not factored in a lot of other costs, like example you are going to hire somebody from the marketing team to talk about this. So, you need to pay their salaries, right. Manpower costs, you need somebody who is going to scale this technology up and be in the manufacturing division or design division. So, you have a team of people whom you need to pay the salaries for. So, you have not factored in the salaries in the first set of products which you are looking at. So, let us say you are making the first 100 products of 1000 rupees and you are paying salaries worth of lakhs, then basically you are in losses. You have not factored in the office costs and the cost of maintenance of a website, the cost of an app developer, cost of maybe travel and other transport and whatnot. So, there are so many costs like which comes along, like the cost of running the company. There could be cost of a chartered accountant which you have hired, like which who is going to give you like reports quarterly or annually. So there are so many costs which are involved, and we need to factor that in and clearly understand how big is the startup cost. Do I have that much of a capital inflow? So many a times we would not be from very wealthy background, so I may not have like a few crore of rupees to start a company. So how do I do this? So startup costs can be recovered from several places. One is known as a bootstrapping, where you are basically pooling in money from your families and friends, and your existing money from your job or something which you have saved, that is known as bootstrapping. The other techniques are, you have a fundraising. Fundraising can be from venture capitalists. If your idea is very, very unique, it could be through crowdfunding. You may write grants to government agencies for generating revenues. So all this have to be factored in, whether you will be able to do this and meet up the startup cost. If your startup cost is 2 crore rupees to set up your startup, and all you have is 1 lakh of rupees and no idea where you will get the 1 crore 90 lakh, then probably it's not a great idea to pursue that startup, because you will eventually run out of your money and be really frustrated, like that things are not moving, I'm not getting the right parts and other things which are needed, and a lot of things will break down, like during your product cycle, or your marketing campaigns may fail. So you have to have enough cushion. So typically the rule of thumb is, if you have a startup initial cost of, let's say, 10 lakhs, and you have around let's say 15 to 20 lakhs at your disposal, through some funding agencies or bootstrapping and everything put together, then you may be in a comfortable position that even if you lose 10 lakhs in the worst case scenario, you will be not hand to mouth, right? You will still have something to recover or put in, or probably get rid of your startup. So that's not the end of your life, right? So understanding the startup cost is a very, very important factor. We should all be mindful of that. Next is capital and finance, which is also partially the part of the startup cost, where we need to understand who is going to finance this startup. Can we get somebody on board who is going to be part of the company, or a shareholder who can put in a certain amount of funds, or your families and friends, or by yourself if you want to start, like that, what is the capital, where are the finances going to come through, and also how I am going to generate the revenue, whether my revenue is planned for the next 6 months, or I am going to start generating revenue after 2 years or 3 years. Typically, if you feel like your product or the service idea, and you have registered your startup company, and your revenue is going to start more than 6 months to a year, then typically that's not a great startup idea to follow through for. If you don't have funding and you feel like you are kind of focused on the revenue, when that will come in and things will start moving, you will expand and really get that nice office and everything, like, and you feel like it's not going to happen within the first 6 months to a year, not a great idea. Because as soon as you start your company, specifically in the healthcare space, like, you will start bleeding money. By bleeding money, I mean bleeding money. Like, so basically you will be putting money in so many directions, like with no time you will have no money for your R&D to actually take your product further. So sometimes it may be a great idea to use all the skill sets which we learn in this course. The idea here is, as an end goal you would like to start a company, but not as a starting point, right? So through all the understanding of the different processes which goes along, we need to get to that point to evaluate at the end of this course, that whether our idea is really worth getting to that point, or our prototype is really worth getting to that point where we can commercialize this and have a profitable startup, right? So this will give you that framework to understand or evaluate any idea or prototype which you may have at this point, or you are trying to build, in order to see whether this is going to fit within that profitable startup domain, or and go further, right? So this will give you the clear insight, and then you can start your company and run a profitable business. So if you do that beforehand, you have started a company and you don't know how to do it, and you have so many technologies at your disposal, most likely you are going to fail, right? So talking more about the right ideas, we have to be mindful of the competition. What is there in the market which is a clear competitor? they are known as direct competitors. There could be several companies which are indirect competitors, right. So, this becomes increasingly important. So, as far as the direct competition is involved, there are again coming back to the thermometer example, because all of us can relate to it. There can be certain companies which are just specifically building thermometers, and they are trying to make that really nice and accessible by amending the cost as well as making the right technicalities, sensitivities and everything. So, they have been focused on the thermometer. So, you are directly competing with those brands, and there are several companies which have thermometers as peripherals. So, their main bread and butter of those companies are not thermometers. They are probably building much more bigger medical diagnostic device, or they are into other segments like pharmaceutical drugs, and they are doing several other things, and within that big haystack, the thermometer is a needle in the haystack. It is basically one of the very side products which they do not care about too much about improvising or doing anything better to that. It had been just running some business alongside, like where they are gaining a little bit of capital out of that, right. So, they are your indirect competitors in this particular domain. So, I will give you some examples in the thermometer segment. So, there is a company known as Morepen Labs, for example. So, this company builds a lot of diagnostic devices. They have a lot of pharmaceutical ingredients. They are into the API, active pharmaceutical ingredients manufacturing as well, and they have quite a few other domains, like they have lifestyle devices like grooming devices and like other domains. So, thermometer is something which they do sell, but it could not be something like which they want to compete with in the market. So, some are very key products, we know them as a fact, like if we buy a particular blood pressure measurement device, we would probably like to get it from a very reputed brand like Omron, or there are certain, like if we get a certain mask from somewhere, we want to get it from like N95 from a certain particular vendor. If you want to get an antiseptic lotion or some kind of an antiseptic cleaner, maybe Dettol, or you are looking at Savlon. So, there are specific brands. All of a sudden, if some other company comes up with these kind of brands, you may be a little reluctant. So, you have to look at your direct and indirect competition. We will be talking more at length about the competition as we go forward, with a lot of examples in the upcoming lectures. Next part is location. You want to be very mindful of where you are located, because this determines a lot, like into what the rules and regulations and the target customers would be. So, many a times I have seen where companies are willing to kind of start their venture or register their company abroad, or in certain places where taxes are less. There are so many aspects, like, or a collaborator is there, and they are trying to basically set the company there and run operations in their own locality as the bread and butter, and also expand to the other horizons. So, if you have a company which is in the US domain versus European domain versus some other country in the Asia's domain versus Indian domain, the kind of target customers they will be looking at is very, very different, and the sales opportunities are also very, very different. The competitions are also different, and also the regulations are very different. So, certain medical devices, like for example, the insoles, for example, which we wear within a shoe, they are not usually categorized as a medical device, right. Like, you have a standard insole within the shoe, they are very peripheral, they are not in touch with the blood or any other bare skin there. So, basically they are there, and once you modify this insole to something which is kind of a wearable technology, do you need a regulatory approval or do you need not? So, depending on which country you are located in or where exactly you are trying to run your business, the definition can change drastically. So, in some countries it is considered as a certain class of medical device, in some countries like it is not considered as a medical device, it is a peripheral device, right. So, that location becomes really, really important. The location also kind of influences that what exactly you can, what is your outreach. Like for example, if you are stationed at Bangalore, you can probably be closer around a lot of venture capitalists, lot of other firms and people who are looking for joining companies or the startup venture. There is a lot of startup culture there, so you may hire a lot of interns which are willing to do a certain kind of your marketing and sales for almost fraction of a cost, as opposed to if you are in a particular location like somewhere in maybe Chandigarh, for example. So this is startup culture not that big as Bangalore, and basically you may have to hire somebody for much more higher cost, because there is not a lot of manpower availability and lot of network based availability. So based on your location, your entire how you are going to run your startup completely changes, right? And the last part, if you look at it very interestingly, you would think of this as the first point, but this is the last point here, is the technology, right? So with this, I would like to thank you. This is all for the session. Hopefully you have learned something. We'll see you next time for the next class, right?